Aging.
Oh, yeah.
I feel like that's like
Number one.
a slam dunk.
Yep. Hearing loss due to advanced experience in life.
Sure.
Right?
A life well lived.
A life well lived and tinnitus well heard.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
It's another Monday, and that means it's another episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Michael Squires.
What? Huh? Who? What? We have another host. If one is good, two is better. Last week, we introduced you to Dr. Jordan Strong, and this week, we are happily introducing you to Dr. Michael Squires.
That's me.
Together, they form what we like to call Michael Jordan.
Number 23.
And now let me be the first to welcome you, Dr. Michael, to the Ask an Audiologist podcast.
Thanks.
Obviously, you have huge shoes to fill because Dr. Jordan knocked it out of the park.
Seems that way.
And so she set the baseline, and so we expect nothing but perfection from you. Got it.
You got it.
So I think we're going to ease you into your new role with a topic courtesy of Dr. Jenny Velaz out there at Santa Clarita Hearing Center, and it's a simple question. One you have probably heard 1,000 times in your practice. Why do I hear ringing in my ears? So, Dr. Michael, tell every single person who listens to this the exact reason they have ringing in their ears.
Yep. And if you hear this episode and you're curious about something specific, you can email Kevin directly.
Feel free to DM me.
He will report that back to me and I'll get you an answer.
I absolutely will. Wink.
Ringing in the ears.
Yes.
Also known as tinnitus.
Yes.
Or tinnitus. Potatoes, pick your favorite, whichever one you like. That's the one you go with. That's what we do as audiologists. Tinnitus, it is a sound that you hear in your ears and you alone hear it. It's hard to describe sometimes, but there's no right or wrong way to describe it.
Right.
A lot of people will say ringing or buzzing or crickets or cicadas or chirping or sizzling. There's all kinds of ways. Realistically, it's all happening in the same way. There are multiple camps within the audiology, within the medical field, that are trying to figure out what is causing tinnitus or how to treat it. But our best understanding of it at this point is that there is something happening within the auditory system, some type of an infarction, some type of a damage perhaps, that is causing a misfiring of signals to the brain. The area of the brain that is responsible for those auditory signals, that is the area of the brain that's giving that signal. So that's why only you can hear it. If you plug your ears.
So there's a list of things that I'm going to go through that could, in theory, cause tinnitus. Obviously, you're the professional. You know this off the top of your head. I need a cheat sheet. Okay. So you tell me if you've actually seen this in your practice at some point. Okay. And of course, we don't want to violate HIPAA or anything like that. So we'll just speak, 30,000 foot view of this.
Yep, you got it.
Aging.
Oh, yeah.
I feel like that's like
number one.
A slam dunk.
Yep. Well, the thing about aging is the statistics kind of follow aging with degradation of sensory input, right? So we see hearing loss following aging. It's what we call presbycusis. Hearing loss due to advanced experience in life. Sure. Right?
A life well lived.
A life well lived and tinnitus well heard. And so what ends up happening is as that damage occurs, the hearing loss progresses in many cases, then a lot of those patients are going to be the ones that are reporting ringing in the ears.
How about allergies?
Yeah, I see it a lot. In the Mid-Ohio Valley, we're out in West Virginia, there in the Mid-Ohio Valley. We call it the Mid-Ohio Valley crud. Okay. And those allergies, sinus issues, we have a lot of patients that'll come in and talk about ringing or buzzing in their ears, fullness, all of those things kind of happening simultaneously with allergies and sinus issues.
How about this one? Anxiety.
Yeah, and so I'm really glad you mentioned that. The part of the brain that's responsible for fight or flight, it's the limbic system. When that limbic system triggers, that anxiety, stress, depression, anything like that that's triggering that limbic system, it can set off or exacerbate tinnitus. So what we find is that when patients experience something that's particularly stressful, death in the family, car accident, major life events, that stress level will go up. They'll also start to report more perception or higher perception of that tinnitus.
Some other ones that probably people would think would cause it, but might not be aware of. So like ear infections, migraines, noise exposure, of course, and then wax impaction can also do the same thing.
Sure, noise exposure is probably the biggest one there, and the reason for that is you're causing damage to the auditory system, right? Even concerts, things like that. You know, we've all been there. You've left the concert, you got the ringing in the ears, you got the reduced sensitivity for maybe 24 hours, and then it comes back. It's called a temporary threshold shift. But what happens when that's no longer temporary, right? So our military servicemen and women, people who are working in construction or around heavy machinery, occupational damage, occupational hearing loss, noise exposure, that sort of thing. These people are exposed to a lot of noise for a long period of time. And therefore what happens is they have a lot of damage in the ears. That damage is going to cause a higher prevalence of ringing or buzzing.
Got it.
Known as tinnitus.
And here's some other ones that are maybe a little more obscure, and I'm going to butcher the pronunciation of some of these words. So acoustic neuroma or other head and neck trauma, or other head and neck tumors, not trauma, tumors. Anemia, autoimmune, diabetes, eustachian tube dysfunction.
You got it.
Glomus jugular.
Glomus tumors.
Okay, perfect. Meniere's disease, thyroid problems, and muscle spasms. So all of these, in theory, depending on you as an individual, can cause tinnitus.
Sure, and this is a short list. Realistically, there's dozens and dozens of things that can cause tinnitus. Dental issues, musculature. I've seen it from headaches, migraines. There are lots and lots and lots of things that can cause tinnitus. Realistically, what we have to do is, as a medical community, meaning primary care physician, ear, nose, and throat, maybe otology, audiology, we have to really look at this from a holistic perspective, so that, because everybody's going to be individualistic in how they respond to it, how they experience it, what caused it. And so there's no right or wrong. There's no one definite point. There's no blanket determination for what caused that patient's tinnitus. But if we can look at this patient from a wider perspective and kind of narrow it down, tinnitus can sometimes be, like you've mentioned there with that list, can sometimes be a symptom of something else.
Total outlier.
So we want to make sure that if it's a symptom of something else, we're not overlooking that something else, like a glomus tumor, like a brainstem tumor, something like that. You had talked about a neuroma. That's a slow-growing tumor that might get lost in the medical review. It might not be something that we discover until it's a real problem. Oftentimes audiology is the one who recognizes that because they see a difference in the ears and they get that report of tinnitus. Right. So we want to make sure that we're looking at this from a whole patient medical perspective, and really making sure we're checking those big boxes before we just drop down and go like, it's tinnitus. Because quickly, there's a certain population of patients that don't have any of those issues, that don't have any hearing loss, that experience tinnitus. So it's important for those who are watching this to realize that you're not alone. You're not, crazy. You're not an outlier. There is a certain population of patients, although fairly small, that have no other underlying issues, that just experience tinnitus. And that's just the brain's reaction to something that's happened, and it's really hard to put a thumb on that.
So I think the follow-up question would be, that is obviously going to be far long-winded, so I'm going to challenge you on your first podcast to be as succinct as possible. So how do we go about preventing tinnitus, understanding that maybe all elements of life might be causing it?
Well, those of you out there who might know me know that I am long-winded by nature, but I will do my best.
That's what my only job with Michael is, to just keep him somewhat corralled.
My wife
freedom within a framework.
My wife is probably somewhere out there rolling her eyes hearing you say succinct with me in the frame. But how do we prevent tinnitus? Well, first and foremost, what we want to do is make sure that we are keeping ourselves healthy. I mean, that just goes without saying, right? We want to avoid anything that's going to cause any symptom of anything. And so just keeping yourself healthy, well hydrated, all of those things that your primary care doctor is going to tell you, number one. Number two, do yourself a favor in the long term. Wear hearing protection. Protect your ears from that loud noise exposure. And I'm talking things that people do every single day that they may not realize are really damaging. Weed eating, running the lawnmower, chainsaws, shooting and hunting, and that's a kicker too. Over in my neck of the woods, it feels like the hunting capital of the world because that's what we always talk about with our patients. But these guys will say, "Oh, every time I'm shooting, every time I'm practicing, I'm wearing hearing protection." I was like, "Oh, great. Did you get a deer this year?" "Yep." "Did you have hearing protection in?" "Oh, no." You're not wearing it, and it only takes one.
Yeah.
So there are amplified hearing protection and things like that out there that are really, really good. Consult with your audiologist, consult with your primary care doc, and just making sure that all of these health risks are minimized. And that's your best chance of minimizing tinnitus.
Well, I'll say this. For your first episode, I think it was a resounding success. The audience agrees. So to learn more about tinnitus and any other audiology-related information, please head on over to askanaudiologist.com. And Dr. Michael, not that there was ever a doubt, but a job well done.
Thank you.
We'll see you guys next week.
See ya.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
Those pimple popping videos,
Love them.
so good. So disgusting, so gross. I hate myself, but now it's 2023. We can talk about these things in public. Then it's like a slippery slope because then you get to earwax removal, right? And then you can go down a horrible rabbit hole of other things.
Absolutely.